Thank you very much. Thank you for the introduction. Thank you for the invitation. It is an honor and a pleasure to be here, and it is slightly intimidating to give this talk to a room full of people who all know much more than I do about books and reading, because normally I give variations of this talk to rooms full of doctors, and I can say to myself that while they may know much more than I do about the function of the kidney, that's a low bar. I'm probably pretty good on books and reading, so bear with me. I hope some of you knew Kay Vandergrift or knew her work. She went on to teach library science, but it was a long time ago when I was in elementary school and Miss Vandergrift ran the library. So we both grew after that. So in any case, it's a great honor and a pleasure to be here. And dramatically enough, I stand here before you with the two things, the stethoscope in one hand, the picture book in the other, which I actually carry into an exam room when I go in to do a checkup on a baby, and which, through the Reach Out and Read program, thousands and even tens of thousands of doctors and nurse practitioners and primary care providers carry in when we go in to check on children. I'm going to try to make the case for us, those primary care providers, as your partners in this whole idea of teaming up for the whole child. So as I said, usually I give this talk to doctors, and for more than 20 years I've been beginning it with a test, just so that we could establish, my qualifications by saying, if I say to you in the great green room, there was a telephone and a red balloon and a picture of the cow jumping over the... Yeah, but that's not the test. Good. But the test is to ask you, at what age does a child who's been read to do what you just did? At what age does a child who's been read to spontaneously begin? I see 3 fingers. I feel like an auctioneer here. I see 2 fingers. Okay. Sometime before the 2nd birthday. Exactly. Sometime before the 2nd birthday, a child who has been read to will spontaneously begin to do what you all just did. If you come to the end of a familiar sentence or a rhyme and you let your voice trail up in that way, the child will give you the word. And the reason I begin this way when I talk to doctor audiences is to make 2 points. First, that when I'm talking about early literacy skills, I'm really talking early. I'm not just talking about who's reading in 3rd grade, which we know is incredibly important, or who's where by kindergarten entry, which we know is incredibly important. I'm talking about predictable, reproducible cognitive differences that we can see before the 2nd birthday. In other words, that we can see pretty much as early as we can start testing for language at all. We can see skills that relate to written language, to how you react to being read to. And what I want to talk about is why we're doing this in pediatrics, what we're doing in pediatrics, and how we can partner, how we can be part of the network that we're all trying to build to help all children, and especially those children that you just talked about, the ones who get less or are at risk to get less in the home, and therefore at risk to come to school without the same set of tools and knowledge and language and skills and attitudes that they need to succeed. This is all rooted in the understanding of how books and reading relate to the brain. And we love acronyms in medicine. So early brain and child development, which we call EBCD, has been a big topic in pediatrics in recent years. And what we understand about early brain development is that it happens through interactions. It happens because of what you say to the people in your world, or what you signal to them and how they respond. And therefore, if we want to support healthy brain development in children, what we really need to promote are those relationships between children and their caregivers. And the argument that we have been making at Reach Out and Read is that promoting books and reading aloud, early literacy promotion, gives us an evidence-based, tested, proven model for incorporating all of these principles into our daily practice in the exam room. So, you already heard the Reach Out and Read program mentioned. This is a program for what we do while we're taking care of kids, for doing well child care and checkups. And it has 3 essential pieces. It starts in the waiting room with creating literacy-rich waiting rooms with displays and library displays and gently used books and volunteer readers where we can have them to model for parents. Takes us into the exam room where we give advice, anticipatory guidance. Anticipatory guidance and health supervision visits is medical billable jargon for advice at checkups. Okay, and so what we're talking about is incorporating into our routine well-child visits, our checkups, advice about how you use books to build routines, to interact with your child, how you enjoy books with the child, and with that advice comes a developmentally and culturally appropriate book, a beautiful new book that you get at every checkup. We've been giving them starting at 6 months. We're trying to push that back now and figure out what we can best do even in the visits before 6 months and extending through to 5 years. And to be honest, the reason we stopped at 5 years was because of all of you, because we sort of said to ourselves, well, at least then we know from 5 years on that there are other people in the child's life to talk about books and to show them how important books are. But the territory that we wanted to cover was birth to school entry. And we really do want to start early. This began almost 30 years ago now as a collaboration between pediatricians and early educators. It was endorsed early on by our professional organization, the American Academy of Pediatrics. And when we started talking about it, we concentrated on children in poverty, children who weren't growing up with other books. But we've heard over and over again that it's a message that all children need and all families need. And when we started talking about it, we talked more in terms of literacy development and school readiness, but really I think it's found its home in this larger sense of early childhood and early brain development and the ways that we can help foster the kinds of interactions in the home which help children learn and help children develop. We're very proud to be working together with the Institute for Museum and Library Science now on a Prescription for Success initiative, which is part of the kind of partnering. I mean, there you see a prescription for reading, and I can give you the link. It's on our website, which not only prescribes reading books, but getting refills at the library, free books and story time, and visiting museums. Because one of the things that we understand, and I'll come back to this, is in primary care, in pediatrics, we don't have what teachers have in terms of contact that repeats, day after day, and what you can build on. But what we do have is we have the early access. We have the families coming in with their newborns, with their 1-week-olds, with their 2-month-olds, with their 4-month-olds. So we have a chance to make these connections and deliver these messages while the routines are being built in early childhood. Reach Out and Read has been around, as I say, for almost 30 years. It's a big program. This year we'll serve 4.6 million children. We'll distribute 6.8 million books. There are 21,000 doctors, nurse practitioners, pediatricians, family physicians who will be doing this at about 5,600 program sites, health centers, clinics, hospitals, private practices in all 50 states in the District of Columbia. But the impact I really want to show you, and when I was putting this talk together, Rocco said to me, these are librarians, they like research. Okay? So the impact, I promise not too many research slides, but if we make it, there will actually be a brain scan slide, so you'll know I'm real. But the impact I really want to talk about is that, well, doctors give a lot of good advice. My doctor gives me much good advice, but it doesn't always click. Parents actually want this advice. Parents actually want to know how to do this, and if we have these conversations in primary care and we give these books, it turns out, and here's the holy grail in pediatrics oral medicine, people actually change what they're doing. And this is a study, this was a randomized controlled trial from back in 1999 with a couple of hundred low-income families, looking at the percent of parents who are report reading to their children 3 or more days a week. And they enrolled the kids when they were very young, and they followed them, and at the beginning of the study, the control group, which is in red there, and the reach out and read group, which is in yellow there, rates of reading aloud were the same in the two groups. But after a year and a half, with one group getting the books and the advice from the doctors and the other group not, what you see is that 66% of the parents in the intervention group say they're reading aloud 3 or more days a week, and only 24% of the parents in the control group are reading aloud 3 or more days a week. And actually, the parents didn't know what was being studied. What they were being asked about was kind of, what do you do at bedtime? Tell me your routine, tell me everything you do with the child. So we have a bunch of studies to show that if we do this, parents report that they're reading more frequently, looking at books more frequently with their children. They report more positive attitudes, in the sense that if you ask them, what are your favorite things to do with your child, they're more likely to mention looking at books and reading aloud. And if we look at preschoolers, we see, and this is children who are around 3 or 4 years old, if we compare children who are getting this intervention, who are getting the books and the advice at their doctor visits, we see in those preschool years a 6-month difference in their receptive language, in the vocabulary they understand, and a 3-month difference in their expressive language. And this is done by testing the children directly with one-word picture vocabulary tests, not just by asking the parents, but by testing the children. And you could say many things about these studies, including you could say it's striking and maybe sad that a couple of books and a couple of conversations over the years might have that impact, but you could also say, during these years with these populations, maybe nobody else is having these conversations. Maybe we have access here, we have an opportunity, and we've got to use it. So what are we saying to parents? What are the underlying messages of doing this in primary care? The underlying messages is, you are so important. You are your baby's first most important teacher. You're teaching language, you're teaching communication, but also how the world works and how it responds. And that from the time your baby is very, very, very young, books, reading can help with routines, can help your baby enjoy time with you, that you can build those routines which will help your child handle stress and other challenges, and above all, over and over, and your child, your baby, your toddler is going to love books because your baby loves you and loves your voice. And doing this with your baby, even if you yourself are not a confident reader, even if you yourself are not a confident student, doing this together with your baby because of how much your baby loves you will, in the long run, help your child be ready to learn, ready to read in school. And there's an analogous set of messages, I think, for the doctors and the nurse practitioners, for the clinicians. You, as a clinician, and this is true for me, you want to foster those positive parent-child interactions that we know promote healthy development, but it's hard, right? I mean, I have 3 children. If my pediatrician had said to me one stressful day with a cranky child in the exam room who was about to get a shot, you know, you really don't sound very positive when you talk to him, I would probably have, you know, changed pediatricians. It's hard to do. So as a clinician, you do want to enhance that language environment. You want to reduce those disparities that you were just talking about and help families build healthy routines and supportive relationships that buffer stress for children. And you want to partner with parents. And what we have been saying is, here we have a way that lets you do that. Coming in with that book, talking about that book, and also helps you put into practice some of these early brain and child development principles, which I won't belabor, but that we have these windows of developmental opportunity, of learning, as you know, that brain development is affected by your genetic heritage, your neurobiology, your culture, your childhood experiences, your socioeconomic status, and that these early experiences really matter, both in good ways to foster development and also in dangerous ways that can harm the developing brain. And again, the book is a way to make that real, to give you those positive interactions and a script and a way to build routines, because brains are built by back and forth. It's the serve and return, the interaction. It's the child signaling the world, the parent, the adult, the caregiver, and the caregiver responding. That's how they learn. It's those contingent utterances. And you see that as babies babble, right? If in pediatrics, a 6-month-old, a 9-month-old who doesn't babble is a medical red flag, right? Can the baby hear? Maybe the baby can't hear, and that's why the baby hasn't started to babble. Okay, the baby can hear. Maybe the baby is developmentally delayed in other ways. No, the baby's developmentally fine. Is anybody talking to the baby? Is the home unusually chaotic? Is a parent depressed? Something's getting in the way because it's the back and forth which is being interrupted. You already said, so I won't go over it in much more detail, and you all know this, that there are terrible disparities in language development in terms of how much language children are exposed to, and that poor children are at risk, not just for the amount of language, but for the kind. You have to hear responsive, interesting, enlarging utterances from your parents, which make the world a bigger, more complicated place, not just the sort of logistic and even disciplinary utterances, which we all lean on first. And we also know that those early childhood vocabularies, which I was talking about when we studied the Reach Out and Read population, that they predict later vocabularies and school achievement. And none of us like that, in a sense, right? We don't really want to feel that the 4-year-old vocabulary, the 5-year-old vocabulary is predictive, because everyone who works in schools, everyone who works with children is going to put in so much heart and effort in trying to help. But we also know that it's a huge advantage to go into school with an adequate vocabulary, with an understanding of language, with an understanding of how books work. And we also all know that early investment is very powerful because of those neurodevelopmental windows. And the best way to illustrate neurodevelopmental windows is for any of us who have tried to learn a second language as an adult. Right? We know what we know what it's like to try to learn language with a brain that is not neurodevelopmentally good at learning languages. Children have different brains. There's an opportunity there. And one of the guiding principles in pediatrics is always prevention, right? You'd rather immunize than treat children with preventable diseases. So what you really want to do in primary care, in addition to looking for problems, is you want to support conditions for healthy development rather than address all the problems later on. And you want to start as early as possible to improve the environments in which children are growing. So again, the literacy promotion is a way to help parents provide stimulation and stability, meaning routines, which improves the environment and the experiences, stimulates that developing brain, and at least buffers or modulates some of the stress of growing up in difficult circumstances. So, how do books build better brains? High-quality, language-rich parent interactions, right? I see patients at Bellevue Hospital. I'll show you a picture later on. It's the oldest public hospital in America. We don't say to our parents, you need a lot of high-quality, language-rich interactions. And nobody better, and I didn't want anyone to say it to me. We say, he loves the sound of your voice. Try reading to him. Try reading to him the same time every night. Turn off the TV. Take him on your lap. Opportunities and prompts. Spend a lot of time modeling. Here's a great book for a baby, right? It's chewable. It has round edges. It's built for someone without a pincer grasp, right? Because 6-month-olds can't do this yet. They have a whole fist grasp. You back the pages moves around. So what do we model in the exam room? Look, there's a baby. There's the baby's nose, there's your mommy's nose, just that kind of back and forth. Where is it? Can you point to it? What's there? And then bedtime rituals and daily routines, but also as the child grows, the exposure to print and story structures and sequencing and the way stories go from beginning to end. But for everyone who works with school-age children, you know that maybe the most important part of this and the hardest to quantify is the positive association with books and stories. The sense that when you see a book, what you think of is a parent's voice, a parent's lap, the certain knowledge that books are sources of pleasure and information, that if there's something you want to know, it's probably in a book somewhere. And all of this together yields school and preschool readiness. But what we're talking about in the exam room with parents is how to get it into your day. Now, for us in pediatric literacy promotion, the world changed in 2014. As I say, we've been doing this now for 27, 28 years. The American Academy of Pediatrics, our professional organization, had endorsed the program, but in 2014, the American Academy of Pediatrics put out a policy statement calling literacy promotion an essential component of primary care pediatric practice. Quote, the AAP recommends that pediatric providers promote early literacy development as an important evidence-based intervention at health supervision visits for children beginning in infancy and continuing at least until the age of school entry. I mean, for us, this is this was a, the revolution is over and we won moment. And you don't get too many of those. And the Academy advised pediatricians, just as a standard of good care for all children, to advise parents, to counsel about developmentally appropriate reading activities, to provide books for high-risk, low-income children, and to supplement this with posters and parent information materials, and to partner with other child advocates and organizations to influence national messaging and policies. This was big news. Here's the New York Times story. This is Leora McGillner, who's the New York State, the Greater New York medical director, practices at Mount Sinai with her patients, in a book. I think the American Academy was actually a little surprised that everyone was so interested. And it's gone on to, we're trying to build it more and more into pediatric practice. Here are the 5 R's: reading together, rhyming, routines, rewards for everyday successes, and relationships that are reciprocal. I apologize for the number of words on this slide. It's really a very simple message. It's to say, here's our platform in pediatric primary care. We have population-level accessibility. We see everyone. There are government programs to pay for poor children to see us. We have high engagement in that we see families over and over again at a time when they're really trying to figure out how to do the job of being parents. And it's low cost because you can build on an existing infrastructure, on visits that already happen. If you get WIC, you need to get your WIC form filled out. If you're in any kind of program, it'll send you to the doctor to have those visits. And that gives us the potential for early interventions, for interventions that we can take to a big scale for the whole population. So, I've already said this. Let me say this about the waiting room, because the waiting room is where some of our most interesting collaborations with schools and libraries and other agencies have happened. We begin in the waiting room. We try to make the waiting room a literacy-rich environment, and that has to be tailored. There are family practices where there are only children who come at scattered moments. There are huge clinics. We try to tailor it to what people can do, but we try to find a way to use the waiting time to introduce the literacy message, to display information about the library, about books, about literacy resources for parents who want to improve their own skills. When possible, we have volunteer readers. We have they can be amazing. I'll talk more about that in a minute, and gently used books. But the waiting room's also been a place for library collaborations. At Bellevue, there are 3 different public library systems in New York City for reasons I don't fully understand, but we've had them all come in to the clinic. We've had them issue library cards. We've had them hand out information. We frequently have library day. We have reach out and write activities where kids get to, experiment with paper and crayons. We have parent educators who talk about books and reading and reinforce, what's going to happen when the doctor sees you. The doctor's going to give you a book. Do you know why? And we have gently used books for parents to read. This is our clinic at Bellevue. We have these blue mats, which have to be approved by the hospital accrediting agency, JCO, which is always walking around looking for things that could spontaneously burst into flames. I mean, seriously, you can't, we used to have this notice on the vaccine refrigerator that said something like, please close the door to keep the vaccines cold, and they said that the notice is a fire hazard. But anyway, they have approved our blue mats. They can be appropriately autoclaved. And our families, many of whom are Spanish-speaking, call them the escuelitas, the little schools. And you can see the kids. A lot of our readers are medical students at NYU. They want to do something, or pre-meds. So you can see the kids come out of the elevators and go for the blue mats, and just flop down. They know. And if there's ever a day when there's not a reader at this point, parents are really indignant. But I mean, I have to tell you, people come from all over New York City to our clinic. They schlep with kids and extra kids on the subway. It's very hard to predict what times people are going to arrive. They bring extra kids and cousins with interesting rashes. You can spend a long time sitting in our waiting room. And the difference between having a child who's on the mat listening to a story and doesn't want to be called because he wants to hear the end of the story, if you happen to be the doctor in the exam room, it makes a big difference in how the parent looks at you when they finally get in. But these are some other images from waiting rooms around the country. What we do in the exam room, and this is a lot of what I do, is talking to providers about how you give this advice to parents, how we build on the relationship with the primary care provider, how we use this whole conversation. And the most important message, and I'm not going to give you the whole talk, but the most important message is it's not another item on an already too long checklist. Okay, let's do your teeth. Okay, let's do nutrition. Okay, let's do sleep. Okay, let's do literacy. That won't work. The list is already too long. It's already impossible. It's how you talk about sleep. We talk about sleep all the time with parents of infants and toddlers. He doesn't sleep. She won't sleep in her own bed. He goes in his own bed, but then he comes out. So you use the book to talk about the bedtime routines. You use the book to talk about transitions during the day and toddlers and discipline. You use the book to talk about, do you think he's going to be ready for kindergarten next year? All of the other subjects that come up, you do it with the book in your hand, and you use the book in the exam room to see how the parent and child are doing together and what the child is doing developmentally. And again, the idea that this is a message for the parent about the importance of the parent's role, the parent's voice, the routines that the parent or the caregiver sets up. We have one of the reasons you see so many people, we have a big initiative with military pediatricians and military families. And you're using the book to encourage early literacy in a language-rich environment with verbal stimulation and dialogic reading and back and forth, but you're also using the book to encourage parent-child FaceTime with an underlying message of decreased screen time for young children. The American Academy of Pediatrics recommends no screen time for children under 2. This has not been one of our most notably effective pieces of advice. You're also using the book as a way, though, to talk about routines and rituals, but also about positive and responsive parenting. And again, there's no point in saying to anyone, educated or less educated, be a positive and responsive parent. It's like, yeah, thank you very much, right? Using the book gives you a way to model it, and it's a way that people can do. And the essential messages are that reading aloud is important even before a child can talk. Talking, singing, the brain is already working, and again, that your baby will love books because your baby loves you. So, these are... The other piece of this is that parents, especially parents who weren't read to as young children, may not know what it means to look at a book with a baby or a toddler. We've all had the experience, you give the book to the 6-month-old, what's she going to do with it? Eat it. Eat it, of course, that's normal. And sometimes a parent will say, oh, I'm so sorry. Doctor gave you a nice new book, and what did you do? She's too young. But if you say to the parent, let's see what she does with the book, 6-month-olds, the normal thing is they put it in their mouths and the baby does it, then, hey, my baby can do it. So helping parents see. I'm really serious about this. Helping parents see it shouldn't be one more test that a baby or a parent feels like they're failing. So the 6-month-old's going to put it in her mouth. The 12-month-old's going to point with one finger. That's a big deal developmentally. Not hitting the book with his hand anymore, he's pointing. Or the 18-month-old with the better pincer grasp who can turn the board pages. The 2-year-old who doesn't sit still, that's not a sign of attention deficit. You don't medicate it. You talk about how you read to a 2-year-old who doesn't sit still. The 3-year-old who can read to 6-month-olds are so cooperative, man. Yeah. And what we're trying to do very hard right now is think about how to roll this all the way back to the newborn visit and talk to parents about what you do even in those very, very early months, emphasizing the idea that your baby knows your voice right from birth, wants to watch your face, that when you read aloud to an older child, it's a way to spend time with the newborn and the older child both. And that the baby's going to grab the book or eat the book or drop the book, but that the baby's going to like pictures of babies, and that the baby is making that link to your voice. So I'm going to show you this with a 6-month-old, which has been the visit at which we traditionally gave the first book.
Do you see this book? Oh, yeah. Babies at this age love faces. They love to look at baby faces. Yeah. It's such a nice age because they can sit up. He sits up so well, and sitting on the lap is a perfect way to look at books. We give out books starting at 6 months through 5 years of age at well visits to promote lifelong love of reading. And it's a program called Reach Out and Read. And so this will be Larry's first book, but not his last book. Right. And he's doing exactly what he's supposed to do with the book. Well, that's what's so wonderful about board books. Is they're very sturdy. They hold up really well, even to the teething baby. Look how excited he is about books. I mean, his arms out. He's smiling. He's interested. He's looking at the faces. I mean, that is. It's just wonderful. So, have you been reading with him?
Yes, I sit down and read with him. He eats the books, and I see that he sits for a little while, and then he cries, and I have to play something else.
So this is one of our training videos, and if we were doing the training, we would sort of watch the whole thing, and I'd ask you what the baby did, and what the 6-month-old did, and what the mom did, and what the doctor did, and talk about, here's an opportunity, tell her that's not a problem, he does it for a little while, he cries, you're following his cues, you're doing a good job, it doesn't mean he doesn't like it, it doesn't mean he's too young, and we would go on talking about an older child, what's the difference between a 6-month-old and a 1-year-old. Well, I'm not going to read you the difference, I'll show you the difference. Here's a 1-year-old.
How are you guys? Oh, you're okay. Can you say okay? I think you're learning a lot. Here's a book for you. Yeah.
6 months difference in how she handles it.
And all of our well visits, it's something that's important for kids to love to read. This, that. Yeah, what do you see? Do you like to read?
Yes.
Yeah. Well, we just love that the kids get the books early. We hope that you like to read with her. I don't know if there are any times of day that you might spend with her reading a book or on the weekends.
It's mainly on the weekends that I read to her, but her mother reads to her every night. One of the girls.
And she's also with Grandma sometimes too.
Yes.
Who's the caretaker?
Great. So Dad, when she was littler, she would put everything in her mouth. You might remember we were talking about that. Now that she's older, she probably won't do it that often. She'll do it a little bit less. But every once in a while, she's still exploring using her mouth and all of her new teeth.
Yes.
And she's still going to test things. You might see that she, is doing so much better using her fingers to open the book, and she'll also be asking you to read the book. And where before she might just look at it, if she likes the book that you have, or she's interested in something in it, like a cat or an animal that she sees, she might be sort of getting your attention by hitting the book. But she's just really doing great with loving that book.
Yes. It's difficult. I don't read to the girls as much as the mother and working, but I know she does use that as a common tool just before bed. Like 2 or 3 books, one of the girls pick out a book. And then we'll read them all.
So this child is in the conversation. Okay, she's what? Not every words yet, but she's,
It's definitely a common tool.
Well, we love that because they're learning from you how wonderful it is to be together as a family, or even just you and Nyla, and reading the books together is a really nice activity. It's different from everything else that you might do to be with them. Do you want to read the book? Show Daddy the book. You're tricky. Yeah,
Hello, little mouse.
So when you use this to train residents and you talk about child development, one of the things you say is, so for a minute or 90 seconds or 2 minutes of talking about the book, what'd you learn about who's with her during the day? What'd you learn about family routines? What can you observe about the child developmentally? There's a lot of that resident, and I supervise residents in clinic. That resident has a checklist a mile long of things that, you know, he or she is supposed to observe or see or look for, shared attention, communication, vocabulary. It's not easy. You're also supposed to give a number of immunizations and check everything from the teeth to the bone health to the nutritional status. So one of the reasons that this program has been successful with a lot of primary care providers is how much you can see and observe in the exam room by giving out the book. Now, I think I was going to show you the 5-year-old video, but I think I'm going to keep moving and sort of say that, what? What video? All right. I'll see. Hold on. Here's the 5-year-old.
How old are you?
Good, 5.
Are you 5? How many is 5? Show me 5 fingers.
1, 2, 3, 4, 5, 6, 7, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect.
How many do you have?
Oh, 5 and 2. Are you in school?
Yes.
Are you? What grade are you in?
I don't know.
Are you in preschool?
Pre-K.
Pre-K. And what do you like to do in pre-K?
Not in the big building, in the small building.
Okay. And what's your favorite stuff? What do you like to do in pre-K?
I like race cars.
Race?
They have race cars in the school.
Uh-huh.
He loves race cars. So he has books.
Do you have books about race cars?
Oh, yes.
Right.
Oh, yeah.
Books as sources of pleasure and information.
You do? At home or at school?
At home and in school.
Do you have any of these books?
I have this.
You do? Two out
Only that.
All right. And do you have this one?
No.
And what do you think this book's about?
The cookie.
About. So let's see if you can find all the letters in your name right here.
Y-O-U-C-E-F.
Oh, you're so clever.
So what we're trying to do also is think about what we can do in the primary. And you got to remember, once we're seeing school-age kids, if they're healthy, we're only seeing them once a year. Those 2-year-olds and 1-year-olds, we're seeing them every couple of months. But we're trying to find messages that we can go on incorporating even at those annual visits. And then finally, as I say, we do the waiting room, we do the advice, and this works all around giving a beautiful new developmentally appropriate book, the board book for the baby. A lot of good night books. Parents and toddlers are really interested in good night books. we give the books the children love. We give the books the children grow up with. And I spend a lot of time with those videos talking about how you can use those interactions to look at the child's fine motor development, that parent-child interaction, the language, what you get in the exam room for those moments that you spend with the parent and the child in the book. But the last thing I wanted to say was, beyond the visit, here's an opportunity to build relationships in communities, in states, with the library, with the early educators, with the homes, with the schools and the school libraries, with the home visitors, with the adult and family literacy agencies, to really try to make systematic systems change, if I can use both of those words together, that strengthen children's circumstances and advocacy. And I'm just going to take a moment here to say that Reach Out and Read of Washington State is sitting over there at the table. Those are my friends. I'll introduce you later if you want. But this is an amazing organization in the state that does that. And finally, to say that nationally we are working with the Institute of Museum and Library Sciences. We have a grant to find ways to connect the early learning services, the museums and libraries, with the medical community. Come to our website and look at some of the initiatives. One book for Colorado, in which every 4-year-old in the state got the same book. There's that prescription I showed you at the beginning. We have an innovative approaches to literacy grant working with Save the Children to create a culture of literacy in selected rural communities, connecting what goes on in the schools, in the early learning community, and in the doctor's office in their early steps to school success program. Again, going back to what you said when you introduced me, trying to close the achievement gap before it starts. We've got information on what libraries are doing. We've got partnerships that we can point to, like a partnership with the Chicago Public Library to encourage adults to read 20 minutes a day to a child, pledge posters and read aloud book lists. This is their Take 20, Read Plenty. We've got partnership with the Denver Children's Museum. Here's the Alabama Library's prescription for summer reading that pediatricians were giving out. It's not always easy to engage parents. The visits are pressured. There's a long list of things to do. Parents don't always have confidence in themselves, but it's an opportunity to keep coming back and talk about how important this can be for children. Reading is a triumph of the early brain. It involves vision and cognition and memory and phonological awareness and phonemic awareness and vocabulary and sequence and story. Fortunately their brains are better than mine, but it's a hard job even for that very well-designed early brain. There's early literacy skills that are involved, like speech and language, vocabulary, the appreciation of rhyme. It requires memory and attentional skills and executive function, but it also requires those relationships, that back and forth, those responsive contingent parental reactions, the FaceTime, the expansive responses which pick up on what a child notices and enlarge the world. So we'd like to be partners. We'd like to be part of what you do and what happens in communities for children for their whole lives. So I hope you'll think of us in the medical community as potential partners. I've got links to everything I said. I've got links which we can send out to you that can help you find programs in your own cities and in your own states. We are, I think, well, everyone in this room knows this, that it's sometimes a very small thing, or can feel like a very small thing, to give a child a book, but we all know that it is in fact a small thing which can directly change, as a pediatrician, the child's bedtime, the child's bedroom, the child's home, and the child's world. Thank you so much.